Each year, approximately 480,000 people in Germany are diagnosed with cancer. More than half of all patients undergo radiation therapy. This may also damage healthy tissue.
The central problem in radiation therapy is achieving maximum tumor control with minimum damage to neighboring tissue. This has been our challenge from the very start. For example, when a tumor grows behind the eye, we want to protect the optic nerve and the associated nerves as well. With a classic tumor on the larynx, the organ that absolutely has to be protected is the spinal cord, since ultimately the movement of the entire body is coordinated by the spinal cord. And basically, if you move a little farther to the side, in the case of breast cancer, or with head and neck tumors, the plexus, that is, the nerve fibers in the neck, serving, for example, the arm, that regulate the mobility and level of feeling in the arm.
Planning radiation therapy well is a highly complex task. Professor Karl-Heinz Küfer of the Fraunhofer Institute for Industrial Mathematics, ITWM, approached this task from the mathematicians' point of view and was appalled at previously existing procedures.
It used to be that the physicist had to do some follow-up work if he wasn't satisfied. It was trial and error, like finding a needle in a haystack.
A radiation treatment plan contains thousands of possible combinations of all criteria, which in turn mutually affect one another. Finding a balanced state is difficult. Action at one point has to be immediately compensated for elsewhere.
I reduce the dosage a little on this side with these orange balls and want to increase the dosage accordingly somewhere else. Now we have a balance with the same number of balls.
The goal of radiation therapy planning is to reach this balance between irradiating the tumor and healthy tissue. Using software developed in a research group led by the ITWM, these calculations now take place in real time with immediate feedback to the physician.
And he basically sees opportunities and limitations. He gets a wide variety of planning possibilities, a complete representation of what is possible or what is practical.
Professor Jürgen Debus subjected the software to clinical tests at the Heidelberg University Hospital.
It was especially refreshing to have colleagues approach us with completely innovative mathematical methods in order to solve a problem we've been struggling with for so long. The most important thing is that we can take the goals, the patient's life goals, and the patient's requirements into account in planning radiation therapy.
If the physician wants to protect a given area even more, the slider is used to define the maximum dosage, and he immediately sees how other parameters react, how the burden on healthy tissue is reduced, and what dosage reaches the tumor. The software has been licensed by the world market leader and in the future will be available at over 20,000 stations for therapy planning around the world. This means patients will no longer have to make the long trip to specialty clinics in order to benefit from this improved treatment.
Jetzt ist es mit diesem multikriteriellen Optimierungsprogramm möglich, das Optimum wird.
This multi-criteria optimization program now makes it possible to calculate the optimum case for each individual patient, not only based on intuition, but rather using a program, and even lets the patient visualize for himself what the best results would be.